Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, more COVID-19 infections across 14 states and the Federal Capital Territory. Latest figure from the NCDC puts it at 8,068. On our theme, we look at the implications of the trial suspension of hydroxychloroquine and chloroquine by the World Health Organization and ask what more options. And European countries consider reopening their borders. Now, according to the World Health Organization, the Solidarity Trial Executive Group met on the day following the published Lancet findings. This group, which represents 10 of the countries participating in the global COVID-19 therapy trial, agreed that a comprehensive analysis and critical appraisal of this hydroxychloroquine evidence and other data was necessary. According to the health body, the review will consider data collected so far in the Solidarity trial and in particular robust randomized available data to adequately evaluate the potential benefit and harms from this drug. But before now, it was cautious optimism on the use of hydroxychloroquine and chloroquine in the COVID-19 treatment that even the President of the United States and in Nigeria, some state governors touted as useful. On our theme today, we look at how this suspension affects the quest for a vaccine. Nigeria recorded 7 deaths last night and 299 new cases of COVID-19 in 14 states and the Federal Capital Territory, bringing the total number of COVID-19 infections in the country to 8,068. According to the Nigeria Center for Disease Control, a total of 2,311 patients have been discharged from various isolation centers across the country and a total of 233 deaths recorded. Of the 299 new cases, Lagos has 90, Katsina 27, Imo 26, Kano 23, FCT 14, Plateau 12, Ogun 9, Osun 2, Anambra and Bayelsa have 1 each, Delta 7, Borno and Rivers 5, Oyo has 4 cases. A breakdown of the figures by regions shows that Lagos in the southwest with 3,595, followed by Kano in the northwest at 919 cases. The FCT leads the North Central region, maintaining the 3rd highest tally in the country with 519 cases. Borno still leads in the northeast with 255 cases. Edo is top in the south-south with 191 cases, and Ebonyi and Imo now lead in the southeast, having equal number, and that is 33 cases. Now, following the ban on Okada in Plateau State, we're talking motorcycles, the government has procured 350 tricycles to be distributed to commercial motorcycle operators through a hire purchase scheme. The ban in the state a month ago was a response to the COVID-19 pandemic as one of the measures taken to entrench physical distancing. Governor Bala Mohammed, while taking stock of the delivery, explains that this is the first set of the planned 1,000 tricycles to be purchased and distributed by his administration.
This is something that I promise the people of both states. In the fight against COVID-19, we must provide the necessary tools and ingredients for the Nigerian people in both states, our citizens, to be able to exercise the social distancing. We have stopped the use of Okada that is going. And we want to give more number. Now we are in discussion with them. This is the number they have just brought, about 350. But we want to raise it to 1,000 so that each and every crannies of Bauchi will have this, and it will be taken to, and we'll give it on hire purchase to the owners of the motorcyclists that we have banned from plying our roads because of coronavirus. And of course, we are also doing the same thing for the NURTW and transport owners, NAATO, so that they will own about 300 vehicles, golf and smaller vehicles that they will be carrying people along.
And as part of their contributions to curtailing the spread of the coronavirus in the state, members of the National Assembly caucus from Plateau State, they've made a donation, an undisclosed amount, to complement government's efforts in the fight against COVID-19 in the state. Similarly, another donation of an ambulance, ventilator machine, surgical face and nose masks, as well as gloves, hand sanitizers, were also given to the state government by the Nigeria Oil and Gas Industry Intervention as part of efforts to flattening the curve.
In finding local solution, first of all, it has to deal with all our collective efforts. And I want to believe that we're the first to appreciate the effort of one of our own who are from Plateau State, the first local persons to identify how to repair ventilators without even seeing them, and they seen it for the first time here in University of Jos. And I want to tell you, we have picked up the matter, we have tabled the issue. This is one other area of sorting out the matter. Two, we appreciate that what the governor has done is intended again with all of us. We are from a very local society. I am from a very local society. I believe that prior to where we are today, possibly the greater part of our medical processes has to do with herbs. And this very particular has possibly discovered by Madagascar. I want to tell you that it was long time ago, discovered here in Nigeria as cure for malaria. Unfortunately, government didn't act in the manner it's supposed to act.
So a group of 10 countries participating in the global COVID-19 therapy trial, they've agreed a comprehensive analysis is needed, critical appraisal of this hydroxychloroquine evidence and other data necessary, hence suspending the trials. Joining us in the studio is Dr. Onedo Titilayo. She's a pharmacist at the National Orthopedic Hospital, Igbobi, Lagos. Thank you for joining us.
Thank you. I'm glad to be here.
Now, we heard about the temporary suspension by the WHO, the trial of hydroxychloroquine, and this is over safety concerns. Are you worried that this is a period where the whole world is scrambling for a solution, for a vaccine, and then what many people have touted as something that works, even the US president, and then we're seeing the World Health Body putting a suspension, a temporary pause on the search?
Thank you. On one hand, I am worried. On the other hand, I think it is better to err on the side of caution. And I think that is what WHO has done by putting a temporary stop to the trial of hydroxychloroquine arm in the Solidarity trial. Having said that, I would want to say that the trial, the temporary halt in the trial came as a result of the findings from Lancet, where it was reported that a whole lot of people using hydroxychloroquine died. And as a pharmacist, I know that disease condition actually has a way that it affects disposition of drugs. And I think this is what is playing out here, COVID-19 being very new, and not so much is known about it. I think it's the disease condition that is having its own toll.
What do you mean by that when you say disease condition?
Okay, COVID-19 now.
Okay.
Every disease, like chloroquine itself has been used for so long in autoimmune diseases and even in the treatment of malaria. And even it's been reported that it has antiviral activities. It's been reported that it even has antiviral activity against SARS-CoV-1. And I think with that information, that knowledge, that's what made people to be so confident of trying to use it in COVID-19. COVID-19 is SARS-CoV-2. So with what is happening now, I think what would happen is, because the trial has actually begun and a whole lot of data has been collected, and what I know, that there are times that you may have conflicting reports from observational study, which Lancet reported, and the WHO trial is actually a randomized clinical trial of hydroxychloroquine. There are times that you have, what is it called now, conflicting report. But with the data that the WHO has collected so far, I think the data should be evaluated to actually see if their own randomized clinical control trial would report the same findings.
Still talking about it, we understand that the Lagos Commissioner at a point mentioned the clinical trial also for hydroxychloroquine in Lagos. Do you think it should still proceed with this position from WHO on the other hand?
I wouldn't. I think it should still proceed. And the reason being that you have to look at the clinical, the design of the clinical trials now. I'm not so aware of the design. We have to look at it, you compare it with the WHO trial and see. We have to look at the doses that the Lagos State trial is being used. You have to look at the pharmacovigilance reporting system that has been put in place by the Lagos trial. And I would want to say that at this point in time, with what is happening, with what has happened with the Lancet report and the temporary suspension of the WHO trial, the Lagos State trial, if really they have not put in place a pharmacovigilance reporting system, I think this is high time that is put in place.
We heard the Lagos option is the double-blind trial.
Yes, it is a double-blind trial, but then you need active pharmacovigilance reporting, because active pharmacovigilance reporting by clinical pharmacists, that should be stressed. You need clinical pharmacists to be involved in this trial. And if you put that active pharmacovigilance reporting system in place, it will help in early detection and prevention of any drug-related problem.
So moving ahead now, in terms of treatment, Nigeria is still witnessing more cases as well as other countries. How do doctors, handle the cases in terms of treatment?
Okay. The hydroxychloroquine trial, is just one arm of the Solidarity clinical trial. You still have 4 other drugs that are still being subjected to this randomized clinical trial. And just recently, Redensivir, that was actually positioned initially for Ebola, has actually shown some promising results from the trial, and it's been recommended to be used in the severe COVID-19 cases where oxygen supplementation is actually needed. And you still have some other drugs that are being used, but we should know that right now there is no cure for COVID-19. So all we are doing is like empirical treatment, but at the same time, we should not actually shy away from the herbal preparation.
Option.
So we should look inward. We should look at what we can do. And for the vaccines, it takes time for vaccines to actually be come into clinical use, because you have to think about all the stages involved in the clinical trials from stage 1 to stage 4, and we have to be very careful with the use of vaccines. So I know Pfizer has started some clinical trials of some vaccines, and even WHO, there's Solidarity clinical trials of vaccine. So I know Nigeria has actually signified interest, but the information that I have is that NAFDAC said no one has actually approached her for approval for vaccine trial. I think researchers should actually key into this vaccine research trial in Nigeria so that they will be able to play a significant role in the fight against this COVID-19 war.
All right. We'd like to thank you, Dr. Nedo Titilayo, a pharmacist with the National Orthopedic Hospital, Igbobi, Lagos. Thank you for joining us on the program.
You're most welcome.
We'll still have more on the COVID-19 updates when we return. Join us again. So let's now take a closer look at the status of our frontline workers in the middle of COVID-19. Joining us in the studio is Dr. Kayode Adebayo. He's the former chairman, NMA Lagos, and consultant, Lagos State Health Service Commission. Welcome to the program. So, Nigeria, we're hearing over 133 health workers have been infected by the virus. You said that the numbers are increasing. But tell us, how do things look on the front line as an officer yourself?
Well, thanks so much. The frontline event is terrible. You see, let me just give you a scenario. You imagine somebody putting on PPE for 6 to 8 hours. If you ever see them removing the PPE, you will pity them. The first clothes underneath will be soaked with sweat. And for that period of 6 to 8 hours, no drinking or eating or anything. And some of them, by the time they remove the PPE, they'll be sweating and open their mouth to take breath and all that. But then, it's our calling. There's nothing we can do. It's just like a soldier, when there's a war, they go to the war front. So for now, the war all over the world is taking place in our various hospitals. And we healthcare workers are in the front line, laying down our life. A lot have died. At least I've lost about 2 friends now, medical doctors, and some are still in critical conditions. The rate of infection is very high. No matter how careful you are, before you know it could get infected. So it's so bad, but we just have to face it. The unfortunate thing is that I just hope that after this pandemic, the healthcare system in sub-Saharan Africa will not collapse totally. You know, before this, the Europe and America have been mopping up all our doctors and nurses and all that. And during this crisis, of course, COVID-19 exposed every healthcare system in the whole world, not just in Nigeria alone, even in America. You know, it got to a stage in America, they had to be graduating their final year students to become doctors. They did that too in Italy. Now, if they could get to that critical stage, you know how many people have been affected in America too? So at the end of this incident, I am sure Europe and America might mop up most of our healthcare workers. So we need to really look inward and really prepare for that crisis.
And this is hoping our numbers don't get to their numbers.
Well, just hoping that number don't get to their number, because if you look at it, fine, whatever may be helping us, the rate of spread, we might look at it as not as high as being projected, because by projection, I think around 23rd, 24th of April, we are supposed to have about 65,000 infections, but we don't have that. Whatever it is, but when you look at it critically, in the last 2 weeks, we've been having 200 to 300 every day. In another 100 days, what do we have? As at 2-3 weeks ago, all our isolation centers are filled up. Now, the Center for Disease Control said people will be those that are positive will manage from home. When you look at the Center for Disease Control website, their report there, even as at this morning, their report there is, out of the 200 plus that have died, 50% of them died because of self-medication at home. If you check their website now, you will see it there. Now, that means if everybody had been reporting early, maybe by now we just have about 100 deaths plus. Now we have 200 plus. So if they now change to this idea of managing patients in their homes, that means we should be expecting increase in death rate. That means we should be expecting increase of infection across those households.
But I'm sure they will be supervised.
How many homes do you want to supervise? We're talking of a country of over 200 million. Lagos of between 20 to 25 million. We should look at the capacity we have and the manpower before we project into things that could be very dangerous.
All right. Dr. Kayode Adebayo, always a pleasure. Thank you so much. Former Chairman, NMA Lagos, Consultant, Lagos State Health Service Commission. Thank you for joining us, and all the best as you fight on the front line.
Thank you.
European countries are considering easing coronavirus-related border controls. This is coming as WHO is warning of a second peak of cases during the first wave of the pandemic if lockdown restrictions are lifted too soon. Dr. Mike Ryan, the WHO's head of emergency, says that the disease is still on the way up, and so countries need to be aware that it can jump up at any time. In the meantime, over 5.5 million cases have now been recorded worldwide. Sadly, more than 340,000 have died, but about 2.2 million people have recovered.
The World Health Organization is warning of a second wave of COVID-19 infections if lockdown restrictions are lifted too soon. Dr. Mike Ryan says countries where cases are declining should be using this time to develop effective trace and test regimes to ensure a downwards trajectory so as to avoid an immediate second peak.
I think right now, countries in Europe, countries in North America, many other countries around the world in Southeast Asia have to continue to put in place the public health and social measures, the surveillance measures, the public health measures, the testing measures, and a comprehensive strategy to ensure that we continue on a downward trajectory and that we don't have an immediate second peak.
In Uganda, lockdown restrictions are easing out with private cars expected back on roads and shops and restaurants reopening. But everyone is encouraged to adhere to the wearing of face masks in public and physical distancing. Sri Lanka is doing the same thing, but only in the capital city. The country has lifted the daytime curfew for two of its most populated districts, Gampaha and Colombo, leading to crowds forming at markets and transport hubs. There will still be a nighttime curfew between 10 p.m. and 4 a.m. daily in all districts in the country as part of measures by the government to curb the spread of the coronavirus. Health authorities in California have announced that places of worship that were closed under one of the most restrictive coronavirus containment rules in the United States may now open. The California Department of Public Health said that businesses and churches, synagogues and mosques can reopen at 25% occupancy capacity and with other restrictions.
Take responsibility in protecting your health. The NCDC's website has all the information and stats on the cases across states with regular updates and several guidelines also as to how you can efficiently self-isolate. And from the World Health Organization, physical distancing, they've said, is one of the most effective methods to limit the spread of COVID-19. You can take a look at rolling updates on the pandemic and strategies. Each moment, it keeps you updated. Finally, our website, channelstv.com, has the latest news. All you need to do is log on, access the news in health, business, politics, sports, Africa, and around the world, all at your fingertips. www.channelstv.com. That's the COVID-19 update. Thank you for watching. I'll be back again with another update at 6 p.m. Until then, stay healthy.